Don't let a stroke steal your golden years. Imagine you are spending time with loved ones, and then suddenly everything changes. A stroke hits, leaving you with a weakened body and a scrambled mind. But it doesn't have to be this way. Strokes are a leading threat to seniors, but many can be prevented. Don't wait until it's too late. Watch and empower yourself, or your loved ones, to live a long, healthy life free from stroke. Strokes in Seniors, a comprehensive guide. Introduction. Strokes are a leading cause of disability and death in seniors. The World Health Organization lists stroke as the top 2 cause of death in 2019. The CDC in the US lists stroke as the 5th leading cause of death in 2021. Understanding the risks, symptoms, and treatment options is crucial for early intervention and improved outcomes. We now explore the nature of strokes in seniors, addressing common misconceptions and highlighting advancements in stroke care. Understanding strokes. A stroke occurs when blood flow to the brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. In seniors, strokes are often caused by a combination of age-related factors and modifiable risk factors, such as hypertension, diabetes, and high cholesterol. Types of strokes. There are 2 main types of strokes. Ischemic stroke, caused by a blood clot blocking an artery supplying blood to the brain. Hemorrhagic stroke, caused by a rupture in a weakened blood vessel, leading to bleeding in the brain. Risk factors. The risk of stroke increases with age due to physiological changes and the accumulation of risk factors. Common risk factors include hypertension, diabetes, high cholesterol, smoking, obesity, physical inactivity. Recognizing symptoms of stroke. FAST is an acronym used to identify stroke symptoms quickly. We have added BE in front for 2 further symptoms. B. Balance problems. E. Eyesight changes. F. Face drooping. A. Arm weakness. S. Speech difficulties. T. Time to call emergency services. Other less common symptoms in seniors include sudden confusion, dizziness, and severe headache. Early recognition of stroke symptoms and seeking prompt medical attention are essential for improving outcomes. Treatment options. Timely medical intervention is crucial for stroke treatment. Emergency treatment focuses on thrombolytic therapy, administering clot-busting medications to dissolve blockages in ischemic strokes. Clot removal, using mechanical devices to remove clots or repair damaged blood vessels. Treatment window in stroke. Time is critical. The longer the brain is deprived of oxygen and nutrients, the more severe the damage can be. The treatment window for stroke varies depending on the type of stroke and the individual patient's condition, but generally, it is considered to be within the first few hours after symptoms onset. For ischemic strokes caused by a blood clot, the traditional treatment window has been considered to be within 4.5 hours after symptom onset. However, Recent research suggests that this window may be longer for some patients, with studies showing that treatment up to 24 hours after symptom onset may be beneficial in certain cases. For hemorrhagic strokes, the treatment window caused by bleeding in the brain is more variable. The focus of treatment is on controlling bleeding, reducing pressure on the brain, and preventing further damage. The time frame for these interventions depends on the severity of the bleeding and the patient's overall condition. Rehabilitation and recovery. Rehabilitation plays a vital role in helping stroke survivors regain lost functions and improve independence. Therapies include physical therapy, occupational therapy, speech therapy, prevention strategies, lifestyle modifications, maintain a healthy weight, engage in regular exercise, adopt a balanced diet, medication adherence and management, adhere to prescribed medications for hypertension, diabetes, and other underlying health conditions. Regular medical checkups and screenings. Regular blood pressure and blood glucose monitoring. Cholesterol screenings. Misconceptions. Some common misconceptions about strokes include: only the elderly have strokes. Strokes can occur at any age, but the risk increases with age. Strokes are always fatal. Stroke mortality rates have declined in recent years due to advancements in treatment and prevention. Stroke recovery is impossible. With proper rehabilitation, many stroke survivors can regain significant function and improve their quality of life. Predicting stroke in seniors. It is currently difficult. Predicting strokes accurately remains a complex and challenging task due to various factors. Many risk factors contribute to stroke development, and their interactions and impact can vary widely between individuals. Currently, there are no widely available or reliable tests or biomarkers that can definitively predict a stroke before it occurs. Research is ongoing to identify specific biomarkers or brain imaging techniques that may enhance early detection, but these are still in experimental stages. Focus on risk assessment. In the absence of accurate predictive tools, healthcare professionals focus on assessing stroke risk based on established risk factors. By identifying and managing these risk factors, such as high blood pressure, high cholesterol, diabetes, and smoking, the likelihood of stroke occurrence and recurrence can be significantly reduced. Warning signs and transient events. Atrial fibrillation, or irregular heartbeat, can increase the risk of blood clots that can travel to the brain and cause stroke. Sudden, severe headache. Especially a headache unlike any experienced before, could be a sign in some cases. Transientischemicattack, TIA, or mini-stroke. This is a temporary blockage of blood flow to the brain, causing stroke-like symptoms that usually resolve within an hour. A TIA is a strong warning sign that a full-blown stroke could occur and requires immediate medical attention. Recognizing and responding promptly to these warning signs can lead to early medical evaluation and appropriate intervention to prevent a full-blown stroke. Importance of stroke prevention in seniors. Stroke prevention plays a critical role in reducing the incidence and impact of strokes, particularly in seniors who are at an increased risk due to age-related factors. The following measures are essential for stroke prevention. Managing risk factors. Controlling blood pressure. Maintaining healthy cholesterol levels. Managing diabetes. Quitting smoking. Limiting alcohol consumption. Maintaining a healthy weight. Engaging in regular physical activity. Regular medical checkups. Routine medical checkups allow healthcare providers to monitor risk factors, detect early signs of stroke, and provide appropriate medical advice. Healthy lifestyle. Adopting a balanced diet, including fruits, vegetables, and whole grains. Getting enough sleep. Managing stress. Engaging in regular exercise. Medications. Medications such as blood thinners, antihypertensives, and statins may be prescribed to manage risk factors and reduce the likelihood of stroke. Patients should adhere to the prescribed medication regimen as directed. Education and awareness. Educating seniors about stroke risk factors, symptoms, and prevention strategies is crucial. This can empower them to make informed decisions and seek timely medical care if needed. Conclusion. It is imperative to recognize the power that seniors possess in preventing and managing strokes. By arming themselves, or loved ones, with the knowledge of risk factors, symptoms, and prevention strategies, they can significantly reduce the likelihood of experiencing a stroke and enhance the senior's overall well-being. Remember, the key to a healthy, stroke-free future lies in proactive actions. Stay vigilant, adopt a healthy lifestyle, and seek regular medical checkups. Together, we can triumph over stroke and live healthy and fulfilling lives.